Well, during the COVID-19 threat, hospital administrators are being pressed to figure out problems they have never faced before. Jeff Newmeyer is here live outside the Parkview Health Miro Center for an inside look at their operations. Jeff?
Yeah, Brian, you know, the Miro Center off DuPont Road is often used to host doctors, nurses, and other medical care providers for a variety of healthcare conferences. But right now, it's being utilized almost completely as the hospital's incident command center. A giant monitor showing the latest worldwide statistics for COVID-19 towers over tables set up in a horseshoe shape where staff members work on computers at a safe distance apart. In the room, there are communications people, public safety personnel, logistics staff, and infection prevention experts. They're dealing with things like how to best tap into COVID testing resources, long-term plans for ensuring the hospital has enough critical care beds, and working on a common problem in this crisis, figuring out how to overcome shortages of gowns, face masks, goggles, and other personal protective equipment.
Making sure that we have a good stock of PPE. So right now what we're trying to work on is our PPE management plan, because we don't know how long this will last. So we want to make sure that we do have the right PPE that is recommended by our not only the CDC but our infection prevention professionals, to make sure that we have enough of that to last through this, however long it might last.
Now, that monitor I mentioned before serves as a constant reminder of the growing number of positive cases and deaths that are mounting across the nation. The folks in the command center are primarily concerned with evidence of a surge in Indiana, something that we are already seeing, at least to some degree, in the Indianapolis area. If those signs of illness accelerating start to appear here in Allen County, the critical question being asked inside the Miro Center, you'd have to say it would be, are we capable of handling that surge? And again, that's what these folks are working on right now, Brian.
Yeah, and that's something the governor and the state health commissioner spoke on today during the news conference. They said they expect that surge you talked about, Jeff, to happen mid-April to mid-May. So lots of planning going on, and that's what we saw in your story there. Jeff, thank you.